So pelvic organ prolapse is a form of pelvic floor disorder when the muscles of the pelvic organs get weak. So the bladder can fall into the vagina, the rectum can fall into the vagina, the uterus can protrude to the outside of the vagina, the tip of the vagina can protrude to the outside, as well as the bowel can move into the vagina as well. Now, 1 out of 2 women past the age of 45 can experience some form of pelvic organ prolapse. Only 15% seek medical attention. There are many causes for pelvic organ prolapse. You can go from aging to menopause. Obesity is a good reason for it. Having pregnancies, previous pregnancies, pelvic surgeries, and if you have a hard type labor, like you lift heavy things, if you have a chronic cough such as asthma or COPD patients. Sometimes we don't have symptoms to have pelvic organ prolapse. There are some specific ones and non-specific symptoms. The specific symptoms are when the patient comes and say, things are falling out, or I have a protrusion or a bulge, or my partner is feeling a bump while we're intimate. The non-specific ones, when you have pelvic pain, when you have backache, and certainly when these symptoms get worse toward the end of the day, or they get worse with coughing or exercise, when you have difficulty inserting the tampon or the estrogen cream applicator, any one of these symptoms. Also, if you have difficulty emptying the bladder or moving the bowel, you have to do certain manipulation or movements to get that done. These are good causes or symptoms of pelvic organ prolapse. Pelvic organ prolapse is diagnosed by a simple pelvic exam that is done here in the office. It does not require any specific testing or tools to diagnose it. Pelvic organ prolapse can be treated in many ways. We can do the conservative approach by strengthening the pelvic muscles by using Kegel exercises and physiotherapy, or we can support that pelvic muscle by using a pessary, which is a device that holds that prolapse in place. Or we can do the surgical approach, and nowadays with the new advancement we have minimal invasive procedures that allow you to return to your daily living in a short period of time. You do not have to suffer through this. We understand it's embarrassing, but you have to talk to your doctor. That's why we're here.